Now in this video we will focus on the nutrition normally put in the spotting. First of all we will focus on the few general things with first of all to identify the spot. Normally it is asked. So you have to identify the given spot correctly, whether it is Bengal gram, red gram, rice, either it is milled or polished rice, groundnut or something else, what may be the case. Then what is asked next is the energy, protein and fat content may be asked. So you have to focus each of these. Then what is the rich component in a particular spot of the nutrition? Just like pulse rich in the lysine, okay, ragi rich in the calcium. Then what is the deficient component in a particular given spot? For example, cereals are deficient in lysine and threonine, and pulse are deficient in cysteine and methionine, i.e. sulfur containing amino acid. Then what is the public health importance? Just like cereals are used as a staple diet, so polished rice deficient in many vitamin B complexes. In the similar way, there are various nutrients deficient in particular component. If used long time may lead to the some disease or deficiency. Another public health importance is that the thing which is used in the mass consumption may be threat for the adult food adulteration. You have often heard. So you have also addressed, and it may be asked about that. Just like mustard seed are adulterated with the argemone seed. In the similar way, there are many pulses are just like as Lathyrus sativus is as an example. It mixed with the Bengal gram. Now there are various technical terms may be asked in the spot viva beside the spotting. Just like the balanced diet, what is the prudent diet, what is the micronutrient, what is the macronutrient, what is vitamin, and there are many situation based questions may be asked. Now we will move to the next part, the contraception. There is various contraceptives may be put as a spotter. The same thing here also, we have to first identify the spot properly. Then what is this type? It may be asked, it is the barrier, hormonal or using the terminal method. Then what is the generation of the contraception? First generation, second generation, third generation, okay. Then what is the composition or component of the contraceptive? Just like if in a spot there is a mala, D or N asked, it is have a ethinyl, estradiol and levonorgestrel. The component or composition may be asked. Then again, what is the mechanism of action? Copper T have a different mechanism of action, and the hormonal contraceptive have a different mechanism of action. Then what is the failure rate? It is often asked, okay. Then what is the common side effect of the spot? It may be asked. just like bleeding, pain, perforation, PIDs are the common side effect of the contraception. Then what is the contraindication? Every contraception have a different contraindication. It may be relative or absolute. Then again, with related to spot viva, what it is asked, there few questions may be asked in the your spotting viva. Just like what is eligible couple, couple protection rate, or about the Pearl index. Okay, so these are the basic term it may be asked. Then in the next part it is entomology. However, you must be keep in mind that insects are not always harmful, bees are helpful. But here in medical entomology, we often focus on the insects which harmful to us. Again here we first try to identify the spot properly. But please don't write directly. It should be on the based of the characteristic features. Just like for example, CC fly, it has the head, thorax and abdomen. In same case, you will sand fly, soft stick and hard tick have a different feature. Hard tick have a cuticle lining, but in case of soft tick, it is lacking. So you should be identified based on the features, not just randomly, or someone tell that this is putted. Okay, in the same way the mosquito, you have the Aedes mosquito based on the marking. Then in next part, what disease it spread, it might be asked. Just what I discussed about the every spot, it may be asked about the what disease it spreads. Then again the control measures. For a particular insect in entomology, we study about their nature or other characteristic, and based on these we develop the control measures. For example, in the case of the CC fly, we use the DDT. In the same way, for mosquitoes, you read about it in the NVDCP program. The various measure is taken, integrated vector management. So different insect have a different control measure strategy, and it is based on their characteristic feature and life cycle. Okay. Now in next part, drug may be also asked in the spotting. There are various drug, just like ATT, anti-tubercular drug, anti-leprotic drug, albendazole is there. Okay, then there is STI kit also, and aerofol may be, however, it may also be put in the family planning section also. Okay. So about the drug, here mainly you have to identify the drug, which drug it is. Either it is ATT, anti-leprotic drug, or anti-helminthy, or it is from the any STI kit. In different college, maybe there is a variation also. Then next is the for which disease it is used for. Just like for ATT, name itself indicate it is used for the tuberculosis. Then dose may be asked, however it is often written on that. Then what is the common side effect may be asked for the contraindications of the drug. Now one more portion is the environment. In environment there is a various model may be asked, just like Birkefeld filter, slow sand filter. What is asked? First, the identification of the spot, and just like for the Berkey failed filter, it is used for the small scale household level water filtration. Okay, so these type of the question is asked in the environment section. So in short, just take a quick recap. In spotting, there may be spot from the immunization, it may be from the nutrition, it may be from the contraception or family planning, it may be from the entomology, it may be from the drug, it may be from the environment, and there is a miscellaneous spot also. Just like a growth chart, WHO growth chart may be put in it, or might be other thing, it may be missed. Thank you for watching the video. Please give your review and what might be more clarity or anything to write in the comment box. Thank you for watching.